my friends, lungs up. What I want to talk to you about today is an issue that is actually quite central to many people's lives and can play a role in not just how we feel physically and emotionally, but can play a role in how we deal with certain things. And that issue is control. So I want to talk to you today about something that is quite possibly a central theme in your life. It may or may not be, but for many people it is. It's something that can play a role not just in how we deal with certain situations, but also in terms of how we make decisions regarding our lives and how we how we decide to do something versus not do something, or how we will reflect or deal with a situation. It has a lot to do with mindset, and it has a lot to do with a topic that I talk about often, which is what makes some people succeed whereas others do not succeed in anything. It doesn't just mean being successful in business or in your career. It means successful in relationships. It means successful in your health, in other areas as well. And it could really mean anything to you. But the issue that I want to talk about is control. Very often we are asked to deal with issues that are beyond our control. They may be illness, they may be injury, they may be surgery, they may be personal in the sense of a relationship issue, they may be financial, they may be any one of, you name any possible thing that can happen in life. And the issue of control almost always is there as either a central theme or an underlying theme or a secondary theme. And very often I'll hear people say the anxiety or the stress or the worry is worse than the actual thing itself. So you know what, I was so worried about this treatment, and once I actually had it, it's not so bad, or it wasn't so bad, or it wasn't as bad as I think it was going to be. I bring this up because it's related to so many of the other issues that we talk about, and in particular the concept that our mind can either be our best friend or our worst enemy. So there's many factors that relate to how we respond to different issues. I think control is a big one. And it's this loss of control that really freaks people out, and rightfully so. When you feel like you don't have control over your disease, when you feel like you don't have control over what medicines you take or don't take, not necessarily literally, but you feel pressured by your doctor and your healthcare team to take them, when you feel like you don't have control over your movement or your breathing in particular, okay? When you feel like you don't have control over your day-to-day activities or your social life, these things can throw you for a mega loop, okay? They can knock you down. And the question is, once you're knocked down, what are you going to do? Once you're on the floor, what are you going to do? So what I mean by that is, are you going to make a decision to stay down and suffer the consequences of being down there on the floor and all the things that that means? People kicking you, getting dirty, people walking by with bad smells, etc., etc. And of course, I'm being a little facetious. I'm not speaking literally, but the idea is, are you going to stay down there? And you can, and I think, again, I say, are you going to choose to stay down there? And some people say, well, I have no choice, or I have no control over this. And I would make the case that I would make the case that we do have control over a lot of things. I almost said I would make the case that we have control over most things. And that's contradictory to something that I say all the time, which is that we really have no control. And this is where I usually talk about the saying that my grandma Pepe used to say, which is, man plans, God laughs. Okay? So I'm not going to say if we have more control or less control than we thought we did. All I'm going to say is that we do have some control. Okay? We do have some control over our situation. And I talk about the idea of assessment very often. I talk about the idea of observing and listening and watching and interpreting our situation. And like the serenity prayer, okay, what I would say to you is, in the areas where you do have control over what you do and what you don't do, or you do have control over certain things in your life, I would say exercise that control to help make your life better, okay? And in the areas where you absolutely have no control, and there are definitely going to be some of those in life, okay, then you have to find a way to reconcile that with your thinking and with your mindset and with your decisions as to what you're going to do to help yourself get through and live your best life, okay? So the idea behind this, okay, it's very similar to the Martin Luther King saying that I mentioned to you the other day, which is, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. And I added the last part of it, which is, if you can't crawl, then breathe. And it's also like the Teddy Roosevelt, do what you can where you are with what you have, or do what you can with what you have where you are. And what both of these things have in common, and what I'm trying to say to you, is that look for that daylight. Look for that daylight where you have an opportunity to do something, okay? Look for that opportunity. Look for that wiggle room where you say, hey, you know what? I usually do 15 minutes on the treadmill. Today I'm going to do 17 and a half, okay? There's a little bit of wiggle room, okay? So you know what? Usually I have, 2 burgers. Today I'm going to have 1.5. I'm going to split one with somebody, okay? Today, usually I would just power through this. I wouldn't think about it. I'm anxious. I would just deal with it and take a Xanax or take a Valium. Today I'm going to exercise my ability to control my breathing and my anxiety with meditation and breathing techniques. So again, you have to divide things and you have to observe things in the respect of asking yourself, well, what are the things I can do something about? And what are the things that I can't do anything about? And believe it or not, I bet if you observe, I think most of us spend much of our time worrying and excoriating ourselves over the things that we actually can't do anything about. Because the things that we can do something about, we either do it or we don't do it, or we know in the back of our minds if we change our mind, we can do it if we want to, okay? But it's the things that we lament over. It's the things that, we have no control over, that we spend our time and our energy and our anxiety and our depression worrying about and thinking about. And it's exactly these things that you have to let go. It's these things that you have to breathe on. It's these things that you have to meditate on. It's these things that you have to say to yourself, there is nothing I can do here, or my work here is done, or whatever mantra it is that you can use to say, this is not a good use of my time and energy. And not only that, it is utilizing my resources. It is burning my resources on things that I have no control over, and it is taking them away from things that I do have control over. So to me, at times where I feel anxious, or times that I feel stressed, or times that I feel like things are out of control, okay? Yes, I do have those feelings, okay? Those are the times when you must hold on to what's good. Those are the times that you must return home to the basics. Those are the times when you must seek balance through the earth, through the breath, where you need to seek grounding, where you need to seek guidance. And again, I talk about this over and over and over again. And I gotta tell you, I'm a true believer, okay? This is not just some BS I'm saying because I think it sounds good, okay? I'm a believer in the breath. So it's at these times when you find your mind drifting, and it's at these times when you find your energy dissipating, and it's at these times when you feel yourself just burning fuel and not really getting anywhere, that you must return to the breath. So I'm going to ask you to just sit back, relax, close your eyes, and take one deep breath. Let your arms hang at your side for now. And what I want you to do is I want you to take a deep breath in and let it out gently. Deep breath in through your nose and out. And deep breath in and stretch it up and let it out. Squeeze it in the back. How many people feel different after that, okay? After those couple of breaths, and it may be one breath for you if you're really good at it, it may be 3 breaths, it may be 5 breaths, it may be 10 breaths, it may be 5 minutes of breathing, but at that point, all that noise that's screaming at you and saying, well, what are you going to do about this? You should have done that. It's like, no, stop the insanity, okay? Because at that point, once you dissipate that adrenaline, once you use up some of that steam and extra firepower that is not going towards anything good, then you can actually retake stock and see what's real and see what is a real concern and see what is a real issue versus what is your mind messing with you, okay? Because the mind can mess with you. It can make you feel more anxious, it can make you feel depressed, it can make you feel sad, it can make you feel like things are worse than they are. It can also make you feel like things are better than they are, okay, which is, I guess, better than feeling worse than they are. But the idea is we must clear all this chemical chaos, all this sympathetic outflow, all of this adrenaline-mediated insanity, okay, and breathe it out and think about the things that you can actually change. And when those things that you cannot change pop into your head, okay, that's the time to breathe and let them go. Okay, now some days are going to be tougher than others. Some days are going to be more anxious than others. Some days are going to be more stressed than others. And on those days, maybe you're doing these breathing techniques every 5 minutes. Okay, but again, Malcolm X, Pulmonary Wellness, by any means necessary. Okay, and the idea is don't waste your fuel in a way. Don't dissipate your energy. Don't burn up your goodness, your good feelings. Don't burn up your willingness to do things, your willingness to try, your mindset, your head. Don't use your resources on something that is a lost cause. If it's done, if you have no control over it anyway, then guess what? There's no sense using your energy for that. I would much rather you do what you have to clear your head and get ready to take stock again, and then take these resources and use them towards the things that we know are helpful to us, like proper medication use, exercise, nutrition, stress management, relaxation, and prevention of infection, okay? And again, as I say to you over and over again, I don't care which one you choose, but when you get into a jam, when you feel like you're struggling, when you feel like the pressure is getting higher and higher, right? Those are the times that I want you to do any one of those 5 things. It means either take your medication in a way that you're supposed to, do 5 or 10 minutes of exercise, eat something healthy or throw something unhealthy in the garbage, stress management, meditation, of course, the breathing, the power of the breath, the healing, nourishing, soothing, calming power of the breath, or wash your hands or do something that's going to boost your immunity, okay? Those are the keys. And while you're doing those things, okay, focus on them. Be present in the moment. And by doing so, that helps to block out all of these negative sensations, all of these chemically mediated, insane thoughts and feelings that we have that are not necessarily real. Now, don't get me wrong. I'm not saying if your heart is beating 150 beats per minute that you should ignore it and say my heart is not really beating 150 beats per minute. But what I'm saying is control the things that we can. When you have an opportunity for some space, when you have an opportunity for some wiggle room, when you have the ability to make a choice between bad goofy and good goofy, angel goofy, devil goofy, okay? Err on the side of angel goofy and do something good for yourself. Do something that will be protective of you. Do something that will be emboldening. Do something that will be strengthening. Do something that will be soothing, calming, confidence building. You get the idea, okay? All good, let's focus on it. All negative, let's breathe it out. Breathe it out. As Buddha says, inhale the good blank and exhale the bull blank. All right? All right, everybody. Have a good day. Focus on your numero uno, your best friend, the breath. Have a great day, everybody.